welcome Dr. Davide Martino to the Ryan Lawrence Tourette Syndrome Foundation Movers and Shakers show. Dr. Martino is a neurologist and leading international expert in Tourette Syndrome and movement disorders. He's a professor of neurology at the University of Calgary's Cummings School of Medicine and director of the Movement Disorders Program, where his work focuses on improving the understanding, diagnosis, and treatment of tic disorders and other neurological conditions. Dr. Martino is widely recognized for his research and collaborations aimed at advancing care for patients with Tourette syndrome worldwide. I'd like to thank you for taking the time and sharing your expertise with us today, Dr. Martino.
Thank you very much, Greg, for having me.
We'll start with first question here. Dr. Martino, for viewers who may not really know who you are, could you briefly tell us a bit about your background and your work with Tourette syndrome?
Sure. I'm an Italian neurologist by training, and I was born and raised and studied in Italy, and then I started my interest in Tourette syndrome actually during a fellowship in London in the UK at the National Hospital, and at that time I was investigating the role of autoimmunity in movement disorders, and particularly with respect to specific infections like Group A streptococcal infections, and that really led me into the world of Tourette syndrome because I started attending clinics with my senior colleagues there, and then I found obviously this condition very interesting and important to explore and also to understand better. And that interest has never left me, and I continued developing a clinical and research interest over the course of the following 2 decades. And this also led to the development of a pan-European project called Tics, which investigated the association between genetic and environmental factors in the development of tic disorders. And this was a multicentric study conducted in Europe, which led to many publications that explored these associations. And when I moved to Calgary, this was also thanks to my contact with my colleague, Dr. Tamara Pringsheim, who leads the Tourette Clinic here in Calgary, and we have been collaborating and working together for more than a decade now.
Great, thank you for that. How do you explain Tourette syndrome to a parent who has just received a diagnosis for their child?
Well, obviously, Tourette syndrome is part of what we call the neurodevelopmental spectrum or neurodivergent spectrum. So it is really part and parcel of a group of conditions that have to do with specific trajectories of maturation of the brain. And there's a lot of overlap between tic disorders and Tourette syndrome and OCD, ADHD, and autism. And this is why it's so important to screen for all these conditions also in Tourette syndrome. But the core of Tourette is obviously tics, and tics really are on a continuum, and they can be just variants of human behavior that may not have a particular impact. And they may go all the way to being impactful behaviors that have an effect on development and growth of the individual as a whole. But overall, they are symptoms that need to be appraised for what they are and for how they impact on the individual, rather than being generally considered a condition that needs to be treated at all costs. So I would say essentially that tics are a variant of human behavior, but that needs to be treated and followed up medically only if it does produce an impact.
Okay. And so along with Tourette's, there's often some misinterpretations or misconceptions about Tourette's. What would you say some of the biggest misconceptions would be about Tourette syndrome nowadays?
Well, I still think that there is a misunderstanding on how tics should be managed within the closed circle of a family, of a short group of people, of the social circle and bubble of the individual. Tics are involuntary behaviors, and as a result, they should be uh, treated, handled, and discussed as such. And so there should be no shame around tics. Parents should feel no shame for their kids ticking, and kids and youth should not, and adults shouldn't feel any shame for having this for having these symptoms. They should just address them and possibly, if needed, seek medical help for them. I guess the other very common misconception is that certain features of Tourette syndrome are like swearing and coprolalia are still, for some reason, considered a core feature of Tourette syndrome, and this is obviously inaccurate and false. And we have also listened. This has come to the attention of the media very recently, and again, this is also coming. This is secondary to a misconception. This is the so-called coprolalia is a very uncommon feature of Tourette syndrome. But overall, I would say that we should work towards minimizing the stigma, and the stigma is often the result of mis or preconception.
Okay. Now, tics over time can change, and why do they sometimes worsen with excitement and stress?
Oh, that's a great question, and a question that we don't have a full biological answer to yet. We
Okay.
know that anxiety is a fuel for tics. It's not the cause, obviously, of tics, but it certainly can raise the volume on tics. And as we know, I mean, anxiety means alertness, being ready, preparing our body to something that can have an impact on us. And so it's not necessarily something negative, but also something positive, a positive excitement. We may have our heart rate can rise even when we are positively excited, right? So all this leads to release of neurotransmitters in the brain, some of which may be related to reward, and this includes dopamine. And one wonders whether there's a relation between this and the increased release of tics that happens during both negative and positive stress. But frankly, we still have to investigate more this mechanism. We don't understand it fully at the moment.
Okay. When would families consider behavioral therapy versus medication?
My first instinctive answer would be always, because because for two main reasons. It's non-invasive compared to medications, even though medications may definitely be non-invasive if properly managed by health professionals. And the second reason is that it teaches skills to individuals, whereas medications don't. And because it is so important for individuals to feel empowered and in control over their tics, and understand them better, understand their body and brain better, behavioral therapy does all these things. Unfortunately, there are more severe situations where you would say maybe medications uh, might offer a stronger help and a quicker help in cases that are particularly severe and incapacitating, but these remain a minority of cases.
Okay. For individuals with severe or complex cases, what emerging treatments or research developments give you hope?
Yes, that's a very important question. I think that we should first of all consider all options that are available on the table today, even for the more severe cases. So, this again doesn't rule out behavioral therapy in the proper hands and with the proper behavioral therapists, but also includes the use of medications. And there are some medications that are there's one new medication that we hope to be able to see in approved for use in North America, which is ecopipam. Um, um, and also, we are learning more and more how to use medications in general, also in combination sometimes when needed. But I think that for all movement disorders and behavioral disorders, our real hope for the future stems also from neuromodulation. So the ability to change the activity of brain networks that are involved at the very root of the generation of tics, and reset them in a way that helps these symptoms. And I'm talking about both surgical neuromodulation, such as deep brain stimulation, which is already used, but still not a lot. But of course, the greatest hope comes from non-invasive neuromodulation. There are several examples of non-invasive neuromodulation that are being trialed and tested in Tourette syndrome, from peripheral median nerve stimulation to transcranial stimulation, like direct current stimulation, magnetic stimulation, and even now the new kid on the block of in the field of neuromodulation, which is ultrasound stimulation. So all the research in all these areas, frankly, is very, very important. And whoever has the opportunity to actually support and help it in some way, including participating to it, it's, I think it's a very important field and avenue, and I would encourage people with lived experience to really learn more about it.
Mhm. Thank you. Many individuals with Tourette syndrome also experience anxiety, OCD, or ADHD. How important is it to treat the whole person, not just the tics?
It is of fundamental importance. As I mentioned earlier, tics is just one feature, are just one feature of a broader neurodevelopmental spectrum. And I mentioned ADHD and OCD in particular, but anxiety and depression and mood control are emotional dysregulation are very, very important features of all these neurodivergent traits. And as a result, and they should be screened for in clinic, and they should be discussed and brought up if they are felt perceived to be a problem by patients and families, and they should be treated when necessary. In many instances, they represent the main problem, not the tics. And so this is something we keep repeating over and over again to our patients, and in general, uh, tics are not just tics.
Great, thank you. One last question to leave you with here. If you could leave families watching with one message of reassurance or hope about Tourette syndrome, what would it be?
Well, I think what really represents a message of hope and reassurance, in my opinion, is that awareness towards tics and Tourette syndrome is increasing, also thanks to work like yours. And I would say that there is a whole community of health professionals who are very eager and keen to help and support, um, and also to help um, expanding and extending this understanding within society. I think that people who live with tics are not alone today, and they should really seek support, help, education, information as much as possible, and this will certainly help um reducing misconceptions, reducing that unnecessary feeling of hopelessness, and move forward. At the end of the day, tics are behaviors that for which the societal system should adjust around, just as much as we have to do something to improve them on an individual basis. It's not just the patient versus society when they have tics. It's also um, there's also possibility to be open, transparent, and discuss tics for what they are, just a behavior, which can become a symptom, obviously. But society should be open and should be informed to receive and understand better this behavior and integrate it in within society. So we should work, and we are working against any stigma related to Tourette, and that will certainly reduce that sense of hopelessness and sometimes despair that people with lived experience may, in certain circumstances, live, experience and live.
Great. Thank you very much for your time and expertise once again. We really appreciate you coming on the show and allowing us to become a little more educated on Tourette syndrome and all your work. Thank you once again.
Thank you very much for having me, Greg.
Okay.